Welcome to Baby Snugs and Coffee Mugs. I'm Krista.
And I'm Kelsey. We're both labor and delivery nurses from Minnesota. In this podcast, we'll be covering all things pregnancy, delivering in a hospital, and caring for yourself and baby postpartum.
This podcast is meant for educational and entertainment purposes only, so please seek medical advice from your healthcare provider. We are so excited for you to join us, so grab your coffee, snuggle up, and keep on listening.
Cheers!
Cheers! Welcome back, everybody, to episode 15 of Snugs and Mugs.
Welcome, everyone. This week, we're going to talk about the birth plan, something a little bit more fun.
A little less educational again.
Yeah, we try.
Yeah, right?
So, right off the bat, should you have a birth plan? It's totally optional.
Yeah.
I think we see it both ways. I would say it's more common not to have one.
Yeah,
but
it really is, yeah.
I always think it's great if you do. I think there's a huge stigma with having a birth plan. I think that people are automatically like, well, if you want everything to go exactly that way, something's for sure going to go wrong.
Right. Like, oh, that's your ticket to a C-section.
Yeah. I don't see it that way.
No.
I truly see it as you have done research and you have prepared yourself to have a baby.
Yes.
You have looked at all the options. You know what you want. You're going to be able to make a decision when the time comes to something that's maybe unchanged.
Mm-hmm. Exactly. And with that being said, though, you do still need to be open-minded. So, best case scenario for me is somebody comes in prepared with a birth plan, knowing that this is how I want things to go, and we potentially will have to make adjustments. But it's just like a whole world of gray, and obviously we can't control everything. We wish we could, because then there would be perfect deliveries all the time. But like Kelsey said, it just shows that like you've researched, and if things do change, then you are kind of prepared for that, and you know, okay, yes, this was option A, but what's option B?
Yeah, 100%. So again, do you need a birth plan? No, you really don't. I think a lot of people come in just being able to vocalize what they want. Mm-hmm. So again, birth plan, you have it all typed out. You're ready to give it to us. But I think even when my patients come in, I'm like, what does your day look like for you? Like,
Right.
What is there that you want? Is there anything that you want me to know right off the bat? And you can just kind of keep us updated throughout your day. Mm-hmm. And that works out too.
And no two birth plans are the same either. Like, you might have the same template, but sometimes your birth plan is literally like, I just want an epidural. Like, I want a safe delivery. I want an epidural. I don't want to feel anything. And that's an okay birth plan. That's still a plan.
I think that is probably like one of the more common question or like answers when I'm like, do you have a birth plan? And somebody will be like, yeah, an epidural. I'm like, cool, that's
Yes.
Totally fine.
Yeah, but it's still a birth plan. And also sometimes your plan is, I'm just going to go with the flow. And again, that's okay. Mm-hmm. Yeah. So let's kind of discuss what we think the purpose of a birth plan is. Basically, I think it kind of helps you consider what happens if things aren't going exactly the right way, right? So say you wanted this, this, and this to happen, and all of a sudden this happens. So what if this happens? It can help you be prepared for all of those what ifs and labors, because you just never know what's going to happen, and you might want it to go a certain way, but it doesn't always. So I think it just helps you be prepared for the changing of the labor.
Yeah, I feel like it helps you feel involved in your medical care and your decisions too. I think that's like a huge thing in today's society, that you want to have a say. And I think this absolutely does. And again, we're telling you to keep an open mind, because things can just kind of go the opposite of what you're thinking. Mm-hmm. But again, you've been educating yourself. You can help us along with those next steps.
Exactly. And then it helps with communication. So one thing we talk about is who's involved in your labor, and it's just a really helpful tool so that everybody who is involved is on the same page. So say you're in labor across multiple shifts, so you go from having one nurse and one doctor or midwife to the next hour you change, and it's change a shift, and you see all these new faces, and we just want to make sure that everybody's on the same page. We're all communicating what you want and what you are hoping for your labor and delivery, and it's just really great for communicating that.
Yeah, with that being said, if a patient brings in a birth plan, I am trying to read it as soon as we are getting into the room and setting everything up. If you are super painful and there's just really no time, I'm just trying to ask you, like, what is the most important thing on here? Like, what is something that you for sure need me to know right now? Mm-hmm. Other than that, I am reading through it. I am going through pretty much everything with you. Like, hey, this is a standard that we typically do anyways. This is a possibility, but if this happens, I'm just trying to kind of give you those warnings too.
Yeah, that's a good point. I actually try to do that with all my patients too, because there are some times that depending on the facility you deliver at, there might be something on a birth plan that they can't do at that place, or they won't do, or they always do. So it's really nice to be able to kind of talk in between contractions if you are painful and kind of just get the gist of the whole birth plan and discuss the most important things to you.
Yeah, for sure.
So we, if you have not seen yet, have made our own Snugs and Mugs birth preference sheet that you can find on our social media. We have a link through our link tree that you feel free to print and bring or just look as a reference. That's fine too. But we kind of want to go through what we think is kind of the ideal, important things that you should have on your birth plan. So let's just start out with who is going to be involved in your birth. So who's your birth squad? So your name, obviously, first. Who is your significant other? If that's the father of the baby, somebody really close to you, whoever. Who's going to be your main support person? Oftentimes we'll see other people involved in the labor. Like for me, I had my mom with me for 2 of the times as well. So who else is going to be in the room and going to be there during the delivery of the baby? Who is your OB or your midwife that's going to be involved? I know that can kind of change depending on where you deliver. We have midwives and OBs who are on call, so you don't always get the right or the person you think you're going to or who you have seen in the clinic. But in some places you do. So just knowing who you kind of expect to be there. And then are you bringing a doula with you? We'd like to know who the doula is. At our facility, we see kind of the same doulas, so we probably already know them. But yeah, it's nice to just kind of know who's your team and what is everyone going to do. So one of the first things I ask is, what do you want from me? So as your nurse, what do you expect from me? What do you need from me? There are times where they need you to be very hands-on, and there are times where people are like, we kind of got this, like you just do like what you need to do for your job, and then other than that, like we'll let you know kind of thing. So I feel like I've seen anywhere in between that whole array of it.
Yeah, I agree. And you can always change your mind too. Like if you start out like, nope, just go ahead. We'll call you later. That's perfect.
Yeah.
Let us know when you want us to be right then and there.
Yes, exactly.
Otherwise, let us know if you have like a specific like role that you're wanting each person to do.
Yeah.
Write down their names.
Yes.
So we know who everybody is that you're bringing in with you.
Yeah.
And if there's anybody that you don't want there, that's always an option too.
So that kind of brings us to pain. So if you're following along on our sheet, it's the help it hurts column. So there's all sorts of kind of things that we do to help with your pain management. Some people prefer to just not be asked about pain, and that's okay. Just let us know so that we don't ask about it. Obviously, we can see you are in pain. We can tell when your pain's getting worse. So we don't need to ask about it. And if you don't want us to, that's okay. We won't do that. What kind of tools did you bring with you, or what kind of tools were you planning on using of ours? So things like a playlist, or do you want some of the calming music on the TV? Were you planning to use the tub, birthing ball, essential oils? I know in our low intervention, we kind of cover a lot of these things, like the distraction things, the comb, any type of things like that we might have at our facility. Our yoga balls, all those things. So if you have anything very specifically that you're like, yes, I absolutely want this, just check that, let us know. We can have the things in the room readily available for you.
Yeah. Or if you know that you want nitrous oxide, let us know. Or again, we obviously talked about the epidural. IV pain medications are also an option. So again, those are all options that you can tell us right off the bat.
Exactly. I think the more we can like discuss right away, if you're not ready to spit a baby out, so we can have everything planned, everything ready. I would rather just be more prepared than not, and like have those things available and in the room, so that if you try that birthing ball and you're like, well, this is terrible, I thought I was going to love it, and now the tub's filled, and then you hop into the tub right away, and then you're like, oh, this is much better. Okay. So as much as we can be prepared, best case scenario, I think we are going to reiterate this 1,000 times because we have talked about it so many times already in this podcast, but the more prepared you guys can be, I think the better things go, because you just know that there's so many different things and so many options. And I just think it puts people's minds at ease to just be a little more prepared.
I agree. Just educate yourself. And again, that's what we're trying to help you get through here at this point.
Yeah. So let's talk about the actual delivery of the baby. So, who is going to announce the gender if you don't know the gender of the baby? So typically what I like to do is if there's a support person, I always find it really fun for the support person to announce the gender. I think it just gives them a level of involvement that they obviously don't have. They're not the one giving birth. But it's just exciting. I don't know. I think for me, I had my husband announce it 2 times, and then the 3rd time I accidentally stole his thunder and said it because I was just so shocked and surprised, and her umbilical cord was in the way, so I just kind of moved it out of the way, and I'm like, oh my gosh, another girl. So sometimes you steal people's thunder, but other than that, I think it's just, knowing who's going to be the person to announce is just, then you don't have to think about it. Baby comes out, and you say, so-and-so, what is it? And then they get to announce, right? Delayed cord clamping. I would say this is on almost every birth plan I've seen.
That they want delayed cord clamping.
Yes.
Yep.
So we do that as a standard at our hospital. As long as the baby comes out and is actively trying to cry, we don't cut the cord till at least a minute or until the cord stops pulsing, meaning that all the blood that is in the cord has gone to the baby. So if you see that on your birth plan, I would think most places probably do that, but it's a great thing to have on there because it is really beneficial for the baby to get kind of all that cord blood into their body. And then who's going to cut the cord? I have had fathers love to cut the cord. I have had the grandma cut the cord. I've had a friend cut the cord. I've had the patient cut the cord. I've even cut the cord.
I was just going to say, I've gotten to cut the cord, and I was so excited when the doctor offered it to me.
The small things that just get us really excited. So it's nice to just know the plan of who's going to be doing that. And if you don't feel comfortable to cut the cord, it's okay. The doctor can cut it too. It's not the end of the world. And then what are we going to do with baby right after baby's born? Typically, we put baby right on your abdomen until the cord is cut, and then they go immediately skin to skin. There are definitely times where people are not comfortable with that. That is not what they want, and that is okay. We just need to know if you need us to dry the baby off a little bit more before we put it on your chest. And then, are you going to keep your placenta? I feel like I have quite a few patients that actually do keep their placenta.
Yeah, I agree.
Some people bury it, some people encapsulate it, just kind of different reasons why people like to do that. But we need to know if you're going to keep your placenta so that we don't discard of it. If you are keeping your placenta, we want to know that we're properly storing it so that when the person that is going to come pick it up from the hospital comes, it is still okay and it's on ice and it's where it needs to be. So please make sure that this is included in your birth plan if you want to keep it.
And speaking on that, if you do plan on encapsulating it, make sure that you have all that information ahead of time. You have to be the one to get all the ducks in the row on your end for that. That's not something the hospital is going to provide for you.
Yeah, no, we do not do that. Let's go on to then for baby. What are we going to do for the baby or with the baby after baby is born? What kind of things are you wanting? Are you okay with?
Yeah, so main question right off the bat that we are going to ask you no matter what is the way you plan to feed baby. So are you breastfeeding? Are you formula feeding? You're going to do both. We want to know. It's one of the first things that we're going to help you with for baby.
Are you pumping? I guess that's another one
too.
Yeah,
it sure is.
Add that. I've had patients that literally their plan is to pump and bottle feed, and that's okay. We, again, want to know so we can get a pump in your room and get ready.
Yeah, no, that was a great thing to add in. We give 3 medications at birth. We'll go into it just a little bit here, but I want you to prepare yourself. I want you to educate yourself because this is a decision that you do have to make for your baby. Erythromycin ointment, that's going to be an eye ointment that we put in baby's eyes. That's just helping prevent infection in the eyes. There's 2 shots that we give. Vitamin K is a shot that's going to help clot baby's blood, and then hepatitis B is a vaccination. So again, educate yourself. Know what you're wanting to give baby. Are you wanting to do 1 or 2 or all 3? It is your call.
And your provider will be talking to you about these things in the office, and we can run through things again when you get to the hospital if you have any more questions about them too.
Absolutely. There's always a pediatrician that would be able to answer those questions too.
Yep.
Circumcision. That's another decision that you have to make for your baby boy if you're having one. I think a lot of people don't realize that they have to make that decision for their baby. So again, educate yourself, prepare yourself. It is typically done in the hospital, or is it something that you're going to wait to do outpatient? But again, make sure you have all of those questions answered for yourself before coming in.
Right.
And then last thing that I think is fairly common is patients wanting to wait until they get home to give baby their first bath. Yeah. We offer it in the hospital. I think a lot of people just prefer to do it at home in their own home. The natural oils on baby are good for them. Their vernix is helping their skin as well. So to just delay that is also a fine option.
And that will bring us to any sort of medical problems that we need to know about. So do you have type 1 or type 2 or gestational diabetes? If you do have these, we will always be checking baby's blood sugar for a certain amount of time, so we want to know ahead of time. And then we also are going to be monitoring your blood sugar in labor, making sure it's not getting too low. Do you have the GBS? When you or 36-ish weeks pregnant, we talked about in one of our pregnancy episodes, they swab you for group B strep, and if you are positive, we want to make sure we know about that, one, so we can give you antibiotics, but two, if you come in and you deliver too quickly and don't get those antibiotics adequately enough, so we can monitor baby a little bit more closely. And then, what is your blood type? If you are Rh negative, we do have to give you RhoGAM after delivery if your baby is Rh positive. So that's a great thing to add onto your birth plan, so that there's just another form of communication and making sure everybody knows kind of what's going on with you. Obviously, all of these things will be in your chart as well, but there are times where people come in and they deliver super fast too. So if you just have this, like, we can just see it in one-stop shop. Everything that we need to know is right there. And then, do you have any allergies? Is there anything that we need to not use in labor or is not safe for you because you are allergic to it? Those are kind of all the things that medically we need to know. And then if you have any other sort of medical diagnosis going on that your birth team should know about.
Yeah, and then we left a little space. So if there's anything else, if you want to use our template, we would love it. Add whatever else you feel like needs to be on there. You can send it our way too if we need to add more. That'd be great. One thing that we do want to touch on as well at the end of this is if you have to go for a C-section.
Yeah.
So, of course, we talked about how this is a world of gray. You never know how it's going to end. There's a chance that you have to go for a C-section. And there's a couple decisions that you have to make right then and there. So if you do have a whole OB team support group, you are only able to bring one person back with you. So maybe just already have it in your mind who that person's going to be.
Yeah.
There is a chance that you will have to be put to sleep to have your C-section too. The goal would ultimately be to have you awake, but if there is an off chance that you have to go to sleep, a couple more decisions that you have to make. Again, who do you want baby to go to right away? You probably won't have anybody in that room. Who are we bringing baby back to? How do you want baby fed? Do you want to try to have us hold off for getting that first breastfeed in? Do you want us to give formula or donor breast milk if baby is just not having it, or if there's a medical reason baby might need food sooner rather than later? Another one I want to touch on is maybe just have family prepared that if that is the case, that you want to be one of the first ones to meet your baby.
Yes.
I think a lot of times you don't think about it. Families waiting back in the room. And I have personally asked family to step out because you, the patient, have not met your baby yet because you had to go to sleep. It's a crappy situation. It's not something we obviously want to talk about. But again, I would want you to be one of the first ones to hold.
Right. Yeah, if I ended up in a C-section, I would be a little bummed if my baby was being passed around the room before I even held him. We
got grandmas and grandpas and aunts and uncles and everybody else except for you. So
as Kelsey said, we can kick people out. If you or your significant other or support person are not comfortable doing so, that's okay. That's kind of what we're there for. So yes, if we need to ask people to leave, that's okay, because again, these are the first few hours of your baby's life. And I think it's pretty fair if you want to be the second person, because obviously the support will be the first one to hold the baby. I think it's fair to be the second person to hold your own child.
And opposite, if you are like, no, let my family love up on my baby. That's also what we want to know, because again, personally, as your nurse, I'm probably going to ask family to step out.
Yes, unless we know otherwise. I think most people probably will.
Yep.
And then do you want your support person to do skin to skin?
Yeah.
Skin to skin is super beneficial for our babies. It's super helpful for regulating their temperature and their blood sugar, their breathing pattern. And then with mom, it's super helpful for breastfeeding and kind of aiding in that. But for support, obviously it doesn't do the breastfeeding benefits, but all those other things are really, really beneficial for them to do skin to skin. So is that something that you want? Is that something the support person is willing to do? I very oftentimes will have the dad do skin to skin while mom's still in recovery until she comes up.
Yeah, and I guess even just in general, even if everything goes according to your birth plan, at what point do you want the support person to have skin to skin too?
Yeah, yep. Typically, I always do it after the golden hour. I think in a couple other episodes we've talked about that first hour after delivery is that golden hour. I always try to encourage my support person after mom's done with the feeding and skin to skin, like, now it's your turn, you can do your skin to skin too. And I think most people take me up on it. Like, I don't know if they just feel like they need to, but I explain it and say these are the benefits. And for sure, the mom's always like, do it, please, please. And so, yeah, I feel like...
Krista's like not giving you an option over here.
No, I'm not.
This is what's up. No.
Until they start pulling your chest hair, I feel like that's when they're like, ow, sorry. So, yeah, I think that pretty much covers our birth plan. If you guys like to, again, you can print it out. You can use our template. We would be so happy if we saw somebody bring it into the hospital. And if you have anything that you think is beneficial or should be added, just let us know, and we are more than willing to add on to our birth preference sheet.
Yeah, everything Krista said. Thank you guys so much for listening.
Thank you guys for listening, and we will chat with you again next week.